Have you ever left your doctor's office with a stack of requisition forms for tests, feeling relieved that you're being thorough about your health, only to later discover that some of those very tests might have hidden the early warning signs of something serious? That crushing feeling when you realize that what was supposed to protect you might have actually delayed a crucial diagnosis. I understand that fear all too well. Just last month, Robert, a 72-year-old patient of mine, came to me after being given a clean bill of health from his regular checkups for 3 years straight. But something wasn't right. He had been losing weight, feeling unusually tired, and experiencing persistent discomfort that everyone, including his doctors, attributed to normal aging. When we finally got the right tests, we discovered a stage 3 cancer that had been developing silently all that time, while certain routine tests had been masking the warning signs. The heartbreaking part, if he had avoided specific tests that created false reassurance, or if his doctors had ordered different screenings instead, his cancer likely would have been caught at stage 1. Today, I'm going to reveal the 5 common tests that seniors over 65 should question or avoid entirely because they might be hiding signs of silent cancer. These insights have already helped hundreds of my patients detect cancer earlier when treatment is most effective, and I promise you, some of these tests will surprise even those of you who consider yourselves well-informed about healthcare. So please stay with me until the end of this video, because this information could literally be life-saving for you or someone you love. Hey there, I'm so glad you've joined me for this important conversation today. Before we dive in, I'd love to know where you're watching from. Drop your location in the comments below, and if you have any questions about cancer screening after 65, feel free to ask them there too. I try to respond to as many comments as possible. And if this is your first time here, please consider subscribing to our channel and hitting that notification bell. We publish new videos every week with vital information about senior health that you won't hear in most doctors' offices. I need to pause for a moment and ask you something really important. Have you or someone you love ever received test results that showed everything is normal, only to continue experiencing worrying symptoms? What was that experience like for you? You know, so many people go through this confusing and frightening journey, feeling like their concerns are being dismissed or that something is being missed. It's incredibly isolating when you feel something is wrong in your body, but medical tests keep saying otherwise. I understand how exhausting it can be to advocate for yourself or a loved one when faced with reassuring test results that don't match up with how you're actually feeling. If you'd like to share your experience, you can simply copy "My experience with misleading test results was," and complete it with your story. Even a brief comment can provide tremendous support to others who might be going through the same thing right now. Your insights help me create more relevant content, but more importantly, they let others know they're not alone in their struggles. Sometimes, knowing that others have navigated similar challenges successfully can provide the hope and courage needed to keep advocating for proper care. Let's dive into the 5 tests that can potentially mask signs of cancer in seniors over 65. I want to be clear from the start. I'm not saying these tests should never be performed. Rather, I'm suggesting that we need to be aware of their limitations and potential to create false reassurance, especially in older adults, where cancer presents differently than in younger populations. The first test that can be problematic for seniors is the standard complete blood count, or CBC, when used alone for cancer screening. Many people believe that a normal CBC rules out cancer, but this is dangerously incorrect, especially for older adults. Here's why. Many slow-growing cancers, particularly those common in seniors like certain lymphomas, pancreatic cancer, and some forms of kidney and liver cancers, may not significantly affect blood counts until they're quite advanced. In fact, a study published in the Journal of Clinical Oncology found that nearly 40% of cancer patients over 70 had completely normal CBCs at diagnosis. The problem becomes even more complex because doctors often attribute subtle changes in a CBC to normal aging rather than investigating further. For example, mild anemia is often dismissed as common in the elderly when it should sometimes trigger additional testing. What many people don't realize is that age-related reference ranges for blood tests are often too broad to catch early cancer signals. A study from the Mayo Clinic showed that using age-adjusted reference ranges for blood tests reduced cancer detection by as much as 22% in patients over 65. The CBC can be especially misleading for cancers like multiple myeloma, where early stages might show very subtle changes that fall within normal limits for seniors. Instead of relying solely on a CBC, older adults should discuss with their doctors more comprehensive blood panels that include inflammatory markers like C-reactive protein, specific tumor markers when appropriate, and tests for specific cancer types based on their risk factors. One practical step you can take is to request copies of your actual test results rather than just accepting the "everything looks normal" summary. Look at the actual numbers and ask about trends over time, as subtle shifts within the normal range can sometimes be more revealing than whether a value has crossed the threshold into abnormal territory. Remember, it's not that CBC tests are bad, they're valuable tools when used correctly. The danger comes when they're used as reassurance to dismiss symptoms that should be investigated further. The second potentially misleading test is the basic chest X-ray when used to screen for lung cancer or metastatic disease. This might be surprising since chest X-rays seem like they would be good at detecting problems in the lungs. However, the truth is that standard chest X-rays miss up to 25% of lung cancers, with even higher miss rates in elderly patients. This happens because older adults often have other lung changes from conditions like COPD, previous infections, or heart problems that can obscure early cancer signs on a simple X-ray. What's particularly dangerous is when doctors order a chest X-ray instead of a low-dose CT scan to investigate symptoms like a persistent cough, shortness of breath, or chest discomfort in someone over 65 with risk factors for lung cancer. When the X-ray comes back clear, both the doctor and patient often feel reassured, potentially delaying proper diagnosis for months or even years. The National Lung Screening Trial showed that low-dose CT scans reduced lung cancer mortality by 20% compared to chest X-rays in high-risk individuals. Yet many seniors are still getting X-rays instead of the more sensitive test. The problem is magnified in older adults because lung cancers in seniors often grow more slowly and may have different appearance than those in younger patients. Some specific lung cancers, like bronchoalveolar carcinoma, now called adenocarcinoma in situ, which is more common in older adults and non-smokers, can appear as subtle haziness easily mistaken for inflammation or scarring on an X-ray. Additionally, chest X-rays are particularly poor at detecting small metastases from other cancers that have spread to the lungs. By the time these become visible on an X-ray, the cancer is usually quite advanced. If you're over 65 with risk factors for lung cancer, including a history of smoking, occupational exposures, or a family history of the disease, and you're experiencing persistent respiratory symptoms, ask your doctor about a low-dose CT scan rather than settling for just a chest X-ray. And if you've had a clear chest X-ray but symptoms persist for more than a few weeks, don't hesitate to request further evaluation. Your life might literally depend on it. The third test that can create problems is the standard PSA, prostate-specific antigen test for prostate cancer in men over 65 when interpreted using standard thresholds. This is a complicated issue because PSA testing itself has been controversial, with changing guidelines over the years. Here's the key issue for seniors. PSA levels naturally increase with age, but the standard cutoff value of 4.0 ng/ml is often applied regardless of age. This leads to two problems. First, in many men over 70, slightly elevated PSA levels may be dismissed as age-appropriate, potentially missing aggressive cancers that need treatment. Second, and conversely, PSA testing in very elderly men can lead to overdiagnosis of slow-growing cancers that would never cause problems in their lifetime, leading to unnecessary and potentially harmful treatments. Research published in the New England Journal of Medicine found that age-adjusted PSA thresholds improved cancer detection in older men while reducing unnecessary biopsies. For example, while 4.0 ng/ml might be appropriate for younger men, experts suggest that for men in their 60s, a threshold of 4.5 ng/ml might be more appropriate, and for men in their 70s, perhaps 6.5 ng/ml. However, a more important factor than the absolute PSA value is how that value changes over time. A rapid rise in PSA, even if the number stays within the normal range, can be more concerning than a stable but slightly elevated level. This rate of change, called PSA velocity, is particularly important in older men but is often overlooked in routine care. Another complicating factor is that many conditions common in older men, including enlargement of the prostate, BPH, prostatitis, and certain medications, can affect PSA levels. Some men over 65 may have falsely elevated PSA due to these conditions, leading to unnecessary worry and invasive biopsies. On the other hand, certain medications commonly prescribed to seniors, including some statins and diabetes drugs, can artificially lower PSA levels, potentially masking cancer signals. The solution isn't to abandon PSA testing entirely for seniors, but rather to approach it more thoughtfully. Men over 65 should discuss with their doctors whether PSA testing is appropriate for them based on their overall health, life expectancy, and personal preferences. When PSA is measured, it should be interpreted in the context of the individual's age, previous PSA history, and other risk factors. And critically, PSA should never be the sole factor in making decisions about prostate cancer diagnosis and treatment in older men. Digital, rectal exams, family history assessment, and in some cases newer tests like the 4K score or prostate MRI should complement PSA results to provide a more complete picture. The fourth problematic test is the standard colonoscopy preparation and procedure in adults over 75, which can sometimes miss right-sided colon cancers that are more common in the elderly. Most people think of colonoscopy as the gold standard for detecting colorectal cancer, and it certainly is a valuable screening tool. However, there are specific concerns with colonoscopy in older adults that aren't widely discussed. The standard colonoscopy prep, which involves drinking large volumes of liquid laxatives, can be more difficult for seniors to tolerate, often leading to inadequate bowel cleansing. Studies have shown that up to 30% of older adults have inadequate bowel preparation, compared to about 10% of younger adults. This is critical because inadequate preparation can result in missed polyps and cancers, particularly in the right side of the colon, ascending colon and cecum, where cancers tend to be flatter, more subtle, and more aggressive in older adults. Research published in Gastroenterology found that the miss rate for right-sided colon cancers in patients over 70 was nearly twice that of younger patients, partly due to preparation issues. Beyond preparation problems, the standard colonoscopy technique itself may be less effective in elderly patients. The colon becomes more elongated and tortuous with age, making it harder to fully visualize all areas during the procedure. Additionally, withdrawal times, how long the doctor spends examining the colon while removing the scope, tend to be shorter in elderly patients due to concerns about comfort and safety, potentially leading to missed lesions. Older adults often have diverticulosis, where small pouches form in the colon, which can hide small polyps or early cancers during a colonoscopy. The risks of colonoscopy, including perforation and bleeding, also increase significantly with age. In patients over 80, the risk of serious complications is nearly 3 times higher than in middle-aged adults. This risk-benefit ratio means that for many older adults, alternative screening methods might be more appropriate. Does this mean seniors should avoid colonoscopy entirely? Absolutely not. Rather, if you're over 75 and colonoscopy is recommended, consider asking about split-dose preparation, taking half the prep the night before and half the morning of the procedure, which has been shown to improve cleansing in older adults. You might also ask about having your procedure done by a gastroenterologist who specializes in geriatric care, who may take more time and use techniques specifically adapted for older colons. Alternative screening methods, including annual FIT, fecal immunochemical test, or the multi-targeted stool DNA test, Cologuard, might be more appropriate for some seniors, especially those with limited life expectancy or other health concerns. These tests, while not as sensitive as a perfectly performed colonoscopy, don't have the same preparation issues and might detect cancers that would be missed due to poor prep in a standard colonoscopy. The fifth test that can be problematic is the standard mammogram for breast cancer screening in women over 75, particularly when used without supplemental screening methods. Mammography has saved countless lives through early breast cancer detection, but its effectiveness and interpretation in older women require special consideration. As women age, breast tissue typically becomes less dense and more fatty, which theoretically should make cancer easier to spot on mammograms. However, this shift doesn't happen uniformly. About 30% of women over 70 still have relatively dense breast tissue, which can obscure cancers on standard mammograms. At the same time, the types of breast cancer, more common in elderly women, including certain hormone receptor-positive tumors and mucinous carcinomas, sometimes have more subtle appearances on mammograms compared to the more obvious masses seen with other types. These factors contribute to a concerning statistic. The false negative rate, cancers missed by mammography, actually increases after age 70, according to research published in the journal Radiology. Another issue is that the standard two-view mammogram, taking images from two angles, may be insufficient for some older women, particularly those with mobility limitations that make optimal positioning difficult. When a woman cannot be properly positioned due to arthritis, kyphosis, spine curvature, or other age-related conditions, portions of breast tissue may not be adequately imaged, creating blind spots where cancers can hide. The situation is complicated further because many women over 75 are told they no longer need regular breast cancer screening based on average life expectancy data. This one-size-fits-all approach disregards the fact that many women in their 70s and 80s are healthy and can expect to live another decade or more. For these women, early detection remains important, but standard screening protocols may be inadequate. So what's the solution? First, healthy women over 75 should discuss with their doctors whether continuing breast cancer screening is appropriate for them, based on their overall health and life expectancy rather than age alone. For those who do continue screening, consideration should be given to supplemental screening methods in addition to mammography, particularly for women with a history of dense breasts. This might include breast ultrasound or, in some cases, breast MRI. Women with mobility limitations should seek facilities that specialize in mammography for older women, where technologists are trained in techniques to accommodate physical limitations while still obtaining comprehensive images. Additionally, clinical breast exams by healthcare providers remain important for older women, as some cancers that might be missed on imaging can be detected through careful physical examination. Finally, breast awareness, being familiar with how your breasts normally look and feel and reporting changes promptly, becomes even more important after 75, when scheduled screenings might be less frequent. I need to make an important point here. While I've discussed 5 tests that can potentially mask cancer signals in seniors, the bigger issue is not the tests themselves, but how they're interpreted and what happens next. The most dangerous words in medicine for seniors might be, "Everything looks normal," especially when symptoms persist. If you're experiencing concerning symptoms and tests come back normal, don't simply accept that result as the final answer. Ask about alternative testing approaches, seek a second opinion, or request referral to a specialist, particularly one who focuses on geriatric care. Remember that cancer often presents differently in older adults, sometimes with vague symptoms like fatigue, unexplained weight loss, or subtle changes in daily functioning rather than the classic warning signs. These differences mean that standard testing approaches developed for younger populations may not be as effective for seniors. Age-specific interpretation of test results is crucial. Laboratory and imaging findings that would be concerning in a 40-year-old might be dismissed as normal aging in someone over 70, potentially leading to missed diagnoses. Conversely, some findings that would trigger aggressive workups in younger patients might represent benign changes in seniors. This nuanced interpretation requires healthcare providers who understand geriatric medicine. Beyond the specific tests we've discussed, there are several practical steps you can take to ensure cancer detection isn't delayed. First, maintain a symptom diary. If you're experiencing persistent symptoms, document them in detail, including when they occur, what makes them better or worse, and how they impact your daily life. This objective record can be invaluable when discussing concerns with healthcare providers. Second, bring an advocate to medical appointments. A family member or friend can help ensure your concerns are fully addressed and can take notes on next steps. Third, always ask this critical question. If these test results don't explain my symptoms, what else could be happening, and how should we investigate? Further, this simple question can prevent premature closure of a diagnostic evaluation. Fourth, request copies of all test results for your records and review them yourself or with family members. Look for values that are near the edges of normal ranges or that have changed over time, even if they haven't crossed into abnormal territory. Finally, consider seeking care from physicians with specific training or interest in geriatric medicine. These providers are more likely to understand how disease presentations and test interpretations differ in older adults. Let's talk about some specific cancer warning signs that seniors should never ignore, even if basic tests come back normal. Unexplained weight loss, losing 10 pounds or more without trying, should always trigger a thorough evaluation. New or worsening fatigue that isn't explained by changes in activity or medication should be investigated. Persistent pain, especially if it's in one specific area and doesn't improve with standard treatments, warrants further attention. Changes in bowel or bladder habits that persist for more than a few weeks should be evaluated, even if a basic urinalysis or stool test is normal. Skin changes, including new growths, sores that don't heal, or changing moles, should be examined by a dermatologist, as skin cancers are both common and treatable when caught early. Persistent hoarseness, cough, or difficulty swallowing should trigger evaluation beyond just a basic physical exam or chest X-ray. Unexplained bleeding from any site, whether it's blood in the urine, stool, or unexpected vaginal bleeding in women after menopause, should always be thoroughly investigated, even if initial tests suggest a benign cause. Neurological changes, including new headaches, vision changes, or subtle changes in mental function or personality, might indicate brain tumors or cancer that has spread to the brain. Changes in lymph nodes, particularly if they're growing, firm, or painless, should never be dismissed as just infection without appropriate follow-up if they don't resolve quickly. Let me emphasize that age should never be a barrier to appropriate cancer diagnosis and treatment. While it's true that some cancers grow more slowly in older adults, and that treatment decisions need to consider overall health and life expectancy, the fundamental right to accurate diagnosis remains regardless of age. Too often, symptoms in seniors are attributed to normal aging without adequate investigation. This age bias can lead to delayed diagnosis and missed opportunities for treatment. Research has consistently shown that older adults are less likely to receive complete diagnostic workups and are more likely to have cancers diagnosed at later stages compared to younger patients with identical symptoms. This isn't just an issue of medical ethics, it has real consequences for quality of life and survival. Many cancers, when caught early, can be treated effectively even in very elderly patients, often with less intensive approaches that focus on maintaining quality of life. Advances in minimally invasive surgeries, targeted therapies, and supportive care have made cancer treatment more tolerable for older adults than ever before. The decision about whether to pursue cancer treatment should be based on the individual's overall health, preferences, and goals, not solely on chronological age. Even for seniors who may choose not to pursue aggressive treatment, and Accurate diagnosis is essential for appropriate symptom management and palliative care planning. To wrap things up, I want to leave you with some key takeaways. First, standard tests can sometimes mask cancer signals in older adults, either through false reassurance from normal results or from age-inappropriate interpretations of findings. Second, persistent symptoms deserve thorough evaluation, even if initial tests come back normal. Trust your body and your instincts if something feels wrong. Third, age-appropriate screening approaches, rather than one-size-fits-all testing, are essential for accurate cancer detection in seniors. This might mean different test thresholds, additional screening methods, or modified techniques. Fourth, bringing an advocate to medical appointments, keeping symptom diaries, and actively participating in medical decision-making can improve diagnostic accuracy. Finally, seeking care from healthcare providers with expertise in geriatric medicine can help ensure that the unique aspects of cancer presentation and detection in older adults are properly addressed. Thank you so much for staying with me through this important discussion. The information we've covered today could literally save lives by preventing delayed cancer diagnoses in seniors. If you found this video helpful, please give it a thumbs up and share it with others who might benefit. Your engagement helps our content reach more people who need this information. If you haven't already, please subscribe to our channel and hit that notification bell so you don't miss our upcoming videos on senior health topics that aren't being adequately addressed elsewhere. Remember, knowledge is power, especially when it comes to your health. You are your own best advocate, and being informed about the potential pitfalls in cancer detection for seniors puts you in a stronger position to ensure you receive the care you deserve. Together, we can work toward a future where age never stands in the way of accurate diagnosis and appropriate treatment. Stay well, stay informed, and remember that it's never too late to prioritize your health.